The relationship between brain and mind remains a hotly debated topic. Therefore, looking in on the operations of the brain may help gain further insight about the mind. Neuroscientists have now expanded the use of neuroimaging techniques to actually capture images while the brain is at work. This technique is called functional magnetic resonance imaging, or functional MRI. Dr. Joy Hirsch of the Sloan Kettering Institute is one of the leaders in this field.
Functional brain imaging is just like conventional imaging, except that we have additional information. Instead of knowing just how the brain looks and seeing all the structures, we can, in addition, look at how the brain works. So when functional imaging, we have two types of information. We have the conventional information about all the structures of the brain, and we have the new information about what areas of the brain are actually working. A very simple task that we might ask a subject to perform is a simple finger-thumb tapping movement where the subject during the imaging sequence just moves fingers and thumbs in this simple rhythmic manner. That activity produces a brain map that looks like this. Here we see the activity associated with the left hand, and here the similar activity associated with the right hand. The center activity here is associated with the controlling or the orchestration of both hands moving together.
Dr. Hirsch and her colleagues have used functional MRI to map sensory, motor, and language regions of the brains of cancer patients prior to surgery.
One of the reasons that Memorial Sloan Kettering that we have a very active functional imaging program is that we are very interested in applying this technique in neurosurgical planning. And in fact, it allows us with great precision to identify areas of the brain that are active in and around a tumor or a possible neurosurgical procedure. And with this information, we can guarantee our patients a safe surgery, essentially, with respect to potential functional loss. So language and sensory and motor are those functions that are oftentimes the most difficult to protect. And we've developed these language tasks partly to understand the brain, but partly to guarantee that for each individual patient that plans a surgery around the language area, that we can provide the surgeon with the information of where the active regions of the brain are.
Mariposa, mariposa, ¿qué te casas conmigo?
This child is being raised in a bilingual family and attends a bilingual school. Children like her seem to be able to learn two languages simultaneously and effortlessly.
¿Qué hizo ese gato?
Eat the mouse.
¿Ya? ¿Me lo puedes decir en español? ¿Comió el ratoncito?
Sí.
¿Se lo comió?
For these children, the ability to speak both languages is controlled by overlapping areas in the brain, as shown in this functional MRI.
Le voilier blanc, oui. Le voilier blanc sur la mer, oui. Encore, positif, négatif.
Many people, however, are not exposed to a second language until high school, college, or later. In these instances, learning a second language can be much more difficult. Some may feel their neurons actually seem to fight against this process. Hirsch's research has shown that for these people, the brain designates a second adjacent area to process the new language.
So what we have learned is that with patients, and we have many patients who speak many languages, particularly here in New York City, that we ask them how many languages they speak, and we map the brain for every language that they speak. And what we find is that, of course, the results with our patients are the same as the results with our subjects, that people who speak many languages and they have learned late in life show a a much larger Broca's area because it's segmented, associated with the different languages.
So as shown in the right side of the diagram, children who learn 2 languages simultaneously have a single brain area for generating complex speech. The diagram on the left shows that someone who learned a second language in adolescence or adulthood possesses 2 such brain regions, one for each language. Functional MRI has a great deal of promise for the future. By clarifying brain functions like language processing, it gives scientists a deeper look into the workings of the mind.
Functional brain imaging offers an unprecedented opportunity to extend conventional imaging, that is structural images, where we look at the brain and know what it looks like. We now extend that to being able to understand where in the brain specific tasks are working. So we have an incredible opportunity that is very new yet in the hands of neuroscientists and physicians. And I think that the door is wide open. We actually have the opportunity to learn about the neurophysiological substrate that subtends many complex human functions, not just language, but music, computations, possibly emotions, perceptions, understanding how the brain achieves these very complex and uniquely human qualities are extremely important and a part of the very near future, I believe.